I've been on roughly 9 or 10 placements throughout the 3 years. I'm mainly based here at the Royal Glamorgan Hospital, but we also do go out. So I've been out on the community, I've been out for a learning disability placement, a mental health placement. I was at a different hospital, and my child development or children's placement then I did separately as well out of this area. I started off in medicine. I did gastro medicine as my first placement in first year. From there then I did a surgical placement in urology and ENT, and then I did community that year as well.
Going into my first placement, I remember feeling really nervous, anxious, not really knowing what to expect, I suppose. I hadn't worked on a ward before, but everyone was really welcoming, and I soon settled in and became part of the team.
I've been a mentor for 15 years, and my role involves giving insight to the student into my role here in outpatients, in the running of the clinics and supporting patients.
I like to see that the students grow from the first time they come here to the end of these 12 weeks. They're very nervous at the beginning, and then you can see them grow with the confidence and the skills that will take them out into the future.
On my first placement, the very first death that I witnessed, I hadn't dealt with that at all in my life really, so my mentor was very supportive and always asking me if I was okay and if I needed to talk about it with anybody and if they needed to get in touch with anybody, if I needed some time to sort of come to terms with it really. As it turned out, I was actually okay. I coped quite well with it, but that support was there. I very much recommend for students considering coming to South Wales to live in at the hospital accommodation. It's very affordable. You share this usually with student nurses, but there are also people in the building, other members of the multidisciplinary team. So like downstairs we have an occupational therapist, there's doctors that live across the way, porters, a bit of everybody. It's a mixed bag, so it is quite nice that it's not just nursing students, that you do have a bit of varied conversation really. Over the past 3 years I've learned an awful lot, seen an awful lot on placements then as well. What I love most probably about the course at the university is applying what you've learned in lectures, bringing it into practice, seeing actually how the body systems work, seeing the medications that you've learned about in university actually been applied to practice then. I suppose if I were to give any advice to prospective students, it would be that this course is most definitely not easy. It's not a walk in the park. It's a job that you have to be very passionate about. But the rewards are unbelievable really once you start on placements and starting to see your patients and see them getting better.